Hello, everyone. Welcome to the Les Turner ALS Foundation's January ALS Learning Series with Dr. Paul Mehta. Before we begin our webinar today, I just want to remind you that you are all muted off camera so you can sit back, relax, and enjoy the presentation, which should last about an hour. You will notice on the right side of your screen, you will have a chat box. Feel free to drop any questions into that chat box for our Q&A portion of the webinar today. And the webinar is being currently recorded, so it should be up on our website and on our YouTube channel within the next couple days or so. So let's get started. I'm Anne-Marie Doyle. I'm the Community Education Manager for the Les Turner ALS Foundation. Thank you for joining us today. And before we get started, I just want to tell you a little bit about the foundation. Oops. There we go. The ALS Learning Series is made possible because of the Gilbert and Jacqueline Fern Foundation and our industry partners, Mitsubishi Tanaba Pharma America. So who are we? We are leaders in comprehensive personalized ALS care and research. We realize that people living with ALS may feel overwhelmed and may not know what questions to ask or where to go to next. And that's where our support service team really shines. Our team is comprised of knowledgeable and compassionate nurses, social workers, and therapists with many years of experience guiding people and their families affected by ALS. We offer a variety of services, including but not limited to ALS care visits by our ALS support coordinators, need-based grants, and connecting people with community resources. At the Lois and Zulia ALS Clinic at the Les Turner ALS Center at Northwestern Medicine, we offer access to enrollment in clinical trials and a multidisciplinary team to provide comprehensive support. We know that making decisions about ALS can be overwhelming, but we're here to help. The Les Turner ALS Foundation has resources to help you learn about your options. Please visit us at lesturners.org. If you're looking for more information on symptoms and care options, or you're interested in browsing past learning series topics, again, all of this can be found on our website at lesturners.org. At the Les Turner ALS Foundation, we also have a dedicated National ALS Registry associate, Cara Gallagher. It's one of the many hats that she wears at our foundation. Cara has been helping people living with ALS, their caregivers, and their families navigate the registry for over 6 years, and you'll have a chance to hear from Cara in a bit. Now let me introduce you to Brad Dusick. Brad overcame tough opponents through his professional football career, and now he's tackling one of his toughest opponents, ALS. But he's not alone. He's doing this alongside the National ALS Registry. And I'm going to play a video for you in a moment. I apologize, my volume is going to cut out just for a second here.
I played football in high school, college, and the NFL. And the way you win, you keep fighting it and keep fighting it, and that's what I do. And right now, I'm fighting against ALS. My name is Brad Dusick. Even though I've got this disease, it ain't whipping me yet.
My dad was a NFL football player, and he is treating it just like he is tackling his opponent, and that is something ALS cannot take from him.
It's not just me. You've got a whole team.
One of the first steps we took was to register with the National ALS Registry. The National ALS Registry collects information on patients with ALS, and they are using this information for valuable research to put these missing puzzle pieces together. That is going to be an amazing feeling that there's families out there that aren't going to have to go through what we have to go through right now.
All the people that have ALS, I don't care what happens, never give up, never quit.
Okay. Thank you so much for sharing that story with us, Dr. Mehta. Everyone, now let me introduce you to Dr. Paul Mehta. Dr. Mehta is the principal investigator for the United States congressionally mandated National ALS Registry, which resides within the Center for Disease Control and Prevention, and is responsible for providing medical, scientific, and epidemiological expertise on matters related to ALS. He's been in this role since 2013. Prior to joining, Dr. Mehta was responsible for overseeing external research initiatives for the National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry. Dr. Mehta started his career at the CDC as a team leader for the Division of Select Agents and Toxins, where he was responsible for the CDC's Etiological Agent Import Permit Program, as well as conducting audits of high containment laboratories nationally. Dr. Mehta has a Doctor of Medicine from Fatima Medical Science Foundation and a Bachelor's of Arts in Biology from the University of Toledo. Welcome, Dr. Mehta.
Thank you, Anne-Marie. Can you guys hear me okay?
I can hear you.
Excellent. I'm going to just turn off my camera just to kind of conserve the bandwidth.
Sure.
So let's go ahead and get started. So first of all, thank you so much to the Les Turner ALS Foundation for the opportunity to speak at this webinar. The foundation is a great partner with the registry, and Andrea, Paul Bachman, Kara, Lauren, Anne-Marie, you guys are great supporters of the registry and great partners to work with. And so we definitely want to thank you for this opportunity and the continued support and partnership with the National ALS Registry. My name is Paul Mehta, and I'm going to talk about how you can join the fight against ALS. Next slide, please. I have no disclosures. Next slide, please. So a quick outline of the presentation. I'm going to talk about how you can join the fight against ALS and why you should join the National ALS Registry, as well as the National ALS biorepository and why it's important and how you can join. We'll be talking about how you can join clinical trials, as well as epidemiological studies that we actually help to support by recruiting, and as well as why take the risk factor surveys that we have within the National ALS Registry. We'll be talking about what we are doing to figure out what causes ALS and the risk factors for ALS. It's really important to figure out what causes ALS. Right now, we have some idea potentially what the risk factors are for ALS, but kind of getting into the weeds to figure out exactly what the etiology, exactly what causes it is very important. And so we do that by actually funding research with the National ALS Registry by funding research partners. We also publish quite a few research publications, so you guys could also read these publications from our partners as well as ourselves. And at the end, I'll take your questions. Next slide, please. So we like to say we do a lot more than just count ALS cases. We're a multifaceted research platform. So we have the National ALS biorepository. We do the epidemiology of ALS in the US, looking at the incidence number of new cases, the prevalence number of existing cases, the mortality of ALS. We work with partner organizations such as the Les Turner ALS Foundation, which is a great partner. Risk factor survey data that patients can go and complete when they come to the National ALS Registry. We also help with clinical trial recruitment as well as epidemiological studies, and we also fund research. And this is really important to kind of hone on to the fact that we actually fund this research to figure out, like I just mentioned, what causes ALS. And more importantly, ALS research counts on you. This is your registry. We are caretakers of this registry, and so we certainly would like to have your involvement as well as be counted too. Next slide, please. So why should you join the National ALS Registry, and why is it important? There are many unknowns about ALS. Like I said, there are probably more unknowns than knowns about ALS. But what we do is we want to find those unknowns and figure out how we could go ahead and potentially make ALS preventable down the road, as well as therapeutics as well. Working with pharma to try to figure out exactly what certain medications out there would potentially could go ahead and be successful down the road. And so the registry offers patients an opportunity to fight back. And they do this by joining the National ALS Registry. And our goals, like I mentioned just briefly, are to figure out what causes ALS, the etiology of ALS, to look at the risk factors of ALS. Was there a particular occupation or a particular exposure or something else that's happening that potentially led to someone's ALS? And we also want to figure out who gets ALS in the country, demographically, by race as well as by gender. And so what we do is we collect and analyze data, we fund external research, and we work with many groups out there to go ahead and inform and educate individuals about ALS as well as the National ALS Registry. We also collect biospecimens via the National ALS biorepository, which I'll talk about as well. Next slide, please. So the question is, how many cases of ALS are there in the United States? ALS is not a reportable disease. So what does that mean? That means in the US, there is no obligation for state health departments to go ahead and notify CDC regarding ALS in their backyard. There are currently only one state, which is Massachusetts, which actually has their own registry. Two states have actually passed their legislation to have their own registries, which is Vermont as well as Maine, and that happened last year. And so what happens is these states collect their data and they'll kind of go ahead and figure out what's happening in their backyard, but there is no obligation for them to go ahead and tell us at this time who has these cases and so forth. We feel we capture between 80 to 85% of cases in the US, and this is done by getting data in from Medicare as well as the VA system, as well as patients coming to our website, cdc.gov/ALS, to go ahead and join. And we can all agree one case of ALS is one too many. Next slide, please. So regarding the number of cases in the US, so last year we published an important report which went into the details regarding exactly how many cases we are missing and what is the actual upper level or the actual point of the number of cases in the US. So we estimate there are about almost 32,000 cases of ALS in the US, and that's as of 2017. And that means there's about 9.9 per 100,000 US population of cases in the US. We estimate we're missing about 14,000 cases, and like I mentioned, because ALS is not reportable to us, we have to use novel methodologies to go ahead and get these cases. A lot of the cases we are missing are those individuals who get their care through private insurance, HMOs, PPOs, and so forth. So they may not actually ever join the Medicare system to go ahead and get their care, or even the VA system, where we have agreements with CMS as well as the VA system to get their data into our system to go ahead and count those cases. But this is a really important thing, because we want to definitely demonstrate the fact that and highlight to the public that there are over 30,000 cases of ALS in the US, which is really important. And that's where, and that's the number we're sticking with, and that's the number we want to convey to the public as well, that there are 32,000 cases of ALS in the US at this time as of 2017. Next slide, please. So how do we come up with this number? This number was actually come up several ways. So we have the self-reported system, which is when patients come into our website and they enroll, and those are about 5,300 cases. We also get these cases from admin systems, like I mentioned, Medicare, the VA system, which is Veterans Health Administration, as well as the Veterans Benefit Administration as well. And we also did a capture-recapture analysis, which kind of estimates the number of missing cases, which were about 14,000. And when you go ahead and add all those up, it's just slightly below 32,000 cases in the US. So that, like I said, it's a much more accurate number of the number of cases and those impacted by ALS. Next slide, please. So just kind of jumping topics of the risk factor surveys. When one comes to the National ALS Registry, they are helping scientists to solve a mystery. They're helping us to figure out exactly what happened in their lifetime that potentially led to their disease. About 90% of ALS is called sporadic, as I'm sure you guys are aware, which means we're not sure exactly what the potential link is, but 10% is familial, which is the genetics portion of ALS, where a certain number of genes, for example, the C9orf72 or the SOD1 gene, could make it more likely that that you can get ALS. But it's the other 90% we want to figure out exactly why patients are getting ALS. And the risk factor surveys come in very, very handy because they allow researchers to figure out exactly, are there certain occupations which are higher risk for ALS? Military service, why are veterans at a greater risk of getting ALS than those who've not served? We know from our data and other individuals, other scientists' data as well, that people who've actually have served in the military, they're twice as likely to get ALS than those who've not served. And we want to figure out why. Also, physical activity, smoking, drinking, are these risk factors for ALS? Also, where did you work? Were you exposed to certain pesticides, during your childhood and so forth? Are these risk factors? For example, and also traumatic brain injuries. Did you play certain sports that potentially, could cause brain injuries and so forth? TBIs, which potentially could also lead to ALS. And so all these things, like I said, it helps us solve the mysteries behind ALS. What causes ALS and why do people get ALS? Next slide, please. So we also have the National ALS biorepository. This biorepository is part of the registry, and what this does, it helps researchers in the areas of genetics, like I mentioned, those ALS genes, SOD1, C9orf72, and others. It also helps us with these samples that we collected, which go out to researchers to look at exactly if certain drugs will work or not, or if they're hopefully, down the road, there's a blood test that we could help contribute to, because right now there is no specific diagnostic test that one could take and simply say it comes back positive, hey, that this person's got ALS. We want to get to that point where there is a definitive diagnostic test for ALS. And the National ALS biorepository also helps you determine, disease progression, whether it's slow or fast and so forth. When we do this by looking at environmental factors such as exposures to heavy metals, lead, arsenic, and others, as well as certain organic pollutants. And these are tough to, what these organic pollutants are, they're very, very tough to break down. They're always in the environment. And these are pesticides, insecticides, and so forth. Could these have potentially caused someone's ALS from a past exposure? Next slide, please. So more information on the biorepository. This is a very, very unique biorepository. We actually will come to the patient's home free of charge to go ahead and collect their blood. And from that blood, it'll be spun down to different segments as well. And from there, all this data we have in the registry is linked to the biorepository as well. So the risk factor survey that I mentioned earlier regarding where did you work, were you in the military, those are all linked to biosamples. And that's very, very valuable for researchers to look at the connectivity behind where did you work and what were you exposed to. And all these samples, like I mentioned, these are all available for researchers to use. These are not leftover samples from another study. These are all, we'd like to call them pristine samples. And also want to say, like I said, I want to highlight the fact that when you join the National ALS Registry, you can simply check off a box and put your information in, and we will send you a packet on how you can join the National ALS biorepository. It's a free service. We come to the comfort of your home to go ahead and collect your blood. And if blood's not permissible or you don't want to do blood, we'll send you a saliva kit as well. And the saliva kit can be mailed to your house, and you can send us back that kit as well. So this is a very, very unique biorepository. Also in the fact that it is from coast to coast. It's not just from one geographic location. It is, like I said, the National ALS biorepository. So we want to make sure we hit both the East Coast, West Coast, the Midwest, and everything else. Next slide, please. This is just a brief overview of the biorepository itself, where we have the in-home collections where patients give their blood, urine, saliva, the postmortem collection where patients can give their brain, bone, spinal cord, CSF, that's put in the biorepository itself. The risk factor surveys are actually matched to the specimens, and then from there, specimens are sent to researchers for their own research program or their own research topic area. Next slide, please. So we also support clinical trials in epidemiological studies. So this is not exhaustive. This is not what you call all clinical trials for ALS, but what we have set up actually is a mechanism for us to help pharmaceutical companies out there, as well as researchers with their trials and their studies. We help to augment these studies. And so they'll come to us, they'll go ahead and say, hey, we want some recruitment assistance. And from there, we'll look over their application and we'll go ahead and send an email to our patient population, and they'll go ahead and reach out directly to the pharmaceutical company or the academic institution, that's doing this particular study. We never ever share your information regarding your names or your address with any sort of researchers. That's extremely private information. What we do, we're kind of like the middleman. We'll go ahead and send an email for those who've actually opted in, and currently about 95% of patients want information about this. And from there, we'll go ahead and send an email, and they'll go ahead and you can go ahead and directly contact that particular research group or a pharmaceutical company and get more information about that clinical trial. To date, we have over 70 institutions who've actually used this particular system, so it's a very, very effective system. And we actually have measured pretty much, as in terms of conservatively, we probably helped to recruit literally between 2,000 or 3,000 patients for these clinical trials since we started this. Next slide, please. And this is just the number of the clinical trials right here. I'm sure some of them you've already heard of. The AMYLIX trial, which was currently approved. That particular AMX 0035 was approved by the FDA last year, and this slows disease progression and improves muscle strength. We also helped to recruit for Mitsubishi Tanabe's oral formulation of edaravone. We also helped to recruit for the Biogen Atlas study, which will administer tofersen to a patient population which potentially may get ALS in the future. So it's almost like trying to give the actual medication before symptoms could potentially happen down the road. So it's a very, very interesting study sponsored by Biogen. We also support the Healy platform trial, which is a very, very popular or very, very large platform trial modeled on the cancer trials, which are very, very effective. And what they do is they'll just have a number of compounds or drugs they're looking at. So we work with these particular organizations to go ahead and help them recruit for these particular trials. Next slide, please. Now, switching topics regarding what we do as in terms of the research we fund. Like I mentioned, research funding is very, very important for us to make sure we can kind of figure out what causes ALS. If we can figure out what causes ALS, the hope down the road is to prevent ALS, and that certainly is very, very important. To date, we've actually funded 24 research institutions academically throughout the US as well as internationally. And this right here is, like I said, it's the bread and butter. And this is something which is very, very unique to us at CDC National ALS Registry, that we do this because with our mandate, we're one of the few ones which are looking at research on how we can, what causes ALS and those risk factors. Other groups may look at other sorts of research. For example, the NIH may look at basic science research or research on genetics. The DoD will do, for example, preclinical research, looking at potential therapeutic compounds and so forth. But for us, what we do here at CDC, and we're the only organization that does that in the US, is we want to figure out what causes ALS. Next slide, please. And this right here is the areas of research we have funded. So like I mentioned, environmental risk factors. There's something called cyanobacteria, which you guys may have heard of, harmful algal blooms. And what happens is this particular exposure could potentially be a risk factor for ALS. Some researchers have made the connection between cyanobacteria and ALS, and so it's certainly very, very interesting work. We also look at, like I mentioned, pesticides and pollutants and how they interact with the actual genes, the gene-environment interaction. We're also funding a group looking at the viruses that people have, and these viruses it's called the human virome itself. And is there a particular virus that someone had previously that potentially led to their ALS? One of the researchers we fund, which next slide will show, is Harvard University, Dr. Alberto Asherio, who last year had a research publication which made the connection between Epstein-Barr virus and MS, multiple sclerosis. And so we're very excited about working with him because he's doing the same thing with the actual this particular study, but it's involving ALS though, and not MS. We also look at genetics, which is really important. We're also looking at military service and the risk for ALS. Why are veterans getting ALS at a higher rate than non-veterans? We're also looking at chronic inflammation, neuroinflammation. The body is one of those things where if there's inflammation, cardiac inflammation, rheumatoid arthritis is inflammation as well. It all leads to certain diseases and so forth. And neuroinflammation appears to be a risk for ALS as well. And so these are just some of the areas that we're actually currently looking at. And what we do is the bulk of our funding, which comes to us, those monies are pushed back to researchers to go ahead and look at these areas. Next slide, please. And this is just some of the current and past funded institutions. Northwestern University, which is a great university. Dr. Tiba Siddiqui is one of our funded grantees. I mentioned Harvard University, Dr. Weisskopf and Dr. Sherrio. We've also funded Columbia, Dartmouth, and so forth. And that previous slide I mentioned to you regarding those research topics as well, those are the ones that, those are the research highlights that we're looking at. We have two here, which is Trinity College, as well as Karolinska Institute. Karolinska Institute actually is in Stockholm, Sweden. And what they do is they have a huge, very large database of patients they can kind of look at from almost from birth to grave and see exactly what they were exposed to, where do they work. And so they have a lot of data right there. And they're using those data to kind of figure out the environmental risk factors for ALS. We've also funded recently just University of Missouri, as well as Stanford in the past as well. Next slide, please. Excuse me. So just in closing, what is the impact of the National ALS Registry? Well, we are the largest database of ALS patients in the United States for research. We are a multifaceted research platform, like I like to call it. We do a lot more than just count ALS cases. We work with drug companies as well as academia to go ahead and provide assistance for clinical trials, as well as epidemiological studies. The National ALS Biorepository, we're advancing ALS research in biomarkers, genetics, as well as exposures, which are linked to the environment. And we fund research, which is really important for us to go ahead and fund these leading academic institutions, which you guys just saw in that previous slide, in order to figure out those unknowns I mentioned earlier in my talk. What are the unknowns of ALS, and making those unknowns knowns. And we also look at the national epidemiological trends. How many cases are there of ALS and so forth. So in essence, we're looking to solve the who, the what, and the why of ALS. Next slide, please. So in conclusion, the registry is pleased and so very happy to work with the Les Turner ALS Foundation. They're a great partner. Kara Gallagher is a great associate when she's able to go ahead and talk to ALS patients about the registry and so forth. Lauren Webb, Anne-Marie, as well as the CEO, Andrea Paul-Spachman. You guys are a great group to work with and a great partner. So those are the slides, and happy to answer your questions.
Thank you so much, Dr. Mehta. So now we do have a number of questions that were submitted to us through our registration process, and I'll also be manning our question box over here. But to kind of start off, Dr. Mehta, what does the registry hope to do this year to increase its visibility and reach and generate some more organic signups?
So it's very important that we work with our partners. The Les Turner ALS Foundation is a great partner. We also work with other groups as well, such as the ALS Association. And working with these partners, it's important for us to go ahead and get the word out, to inform and educate about the registry and exactly what we do and why it's important to join. So we're hoping this year that we're able to go ahead and increase our enrollment, especially the self-enrollment. To be very honest with you, the enrollment was impacted by COVID-19 these past couple of years. The outreach was impacted by by Les Turner and other organizations as well. So, if you're not able to go ahead and speak to patients sometimes, they don't want to sign up, they don't know about the registry. And so this year we want to work with, certainly Les Turner and other groups as well to get the word out. Hey, join the fight against ALS, join the registry, provide your data for researchers to go ahead and figure out what causes this disease so we can help you and help others.
And Cara, anything that that the foundation is doing, or maybe is doing a little bit differently to help with some enrollment?
So the main difference is when I was first hired as the National ALS Registry Associate, I used to be able to go out to families' homes and actually register people there directly and assist with answering all the questionnaires. That is something we can still continue to do. We'll just need to do it virtually instead. So you don't have to have me in your home for the entire 2 hours.
And Dr. Mehta, you mentioned these surveys. Of the 18 surveys offered, which are the most important? And that might be a little difficult to answer, but is there one that you find the most important or the most useful?
So certainly all 18 surveys are very important to take. And you can take them at your own leisure. You don't have to take them all at once. You can take them, for example, one survey one day and kind of come back to it a few days later. So they're all very important. Now, if there's a singular survey, which certainly I think would be the fact that take the surveys about where did you work, where did you live, what were your hobbies, because these all help us to figure out exactly what exposures you guys may have had, patients may have had in the past. And so all these 18 surveys are various puzzle pieces, which when they come together, it's a huge knowledge portfolio for researchers to look at and figure out exactly what are those risk factors and possible etiologies of ALS. And these surveys, like I said, they kind of run the gamut, whether it's, where did you work, where did you live, your history of neurological diseases, and so forth. We even have one survey which allows you to tell us in your own words what you think causes ALS and what you think caused your ALS. And so that kind of helps us qualitatively to kind of figure out, with the patient's own perspective, hey, this is what I feel would cause my ALS. And that's very, very important data because it's coming from the patient themselves to us for us to go and analyze. We're in the process of doing that right now. That will be a very, very interesting report once that comes out, to have the patient's own perspective, what they feel caused their ALS, or what they feel causes ALS. So that's very, very important. But like I mentioned, all these 18 risk factor surveys can be taken at any time, and they can be taken at your leisure. But certainly, please take them when you can. It helps us as researchers to solve the mysteries behind ALS.
Yeah. And Karin, your experience, I know you, just through helping people sign up and complete any of those surveys, any tips or tricks that you might have for folks who are trying to get through those surveys?
Well, I think in the beginning, though, just doing the registering itself, I think people feel like it's going to be a very daunting task. And just so everyone's clear, it will take you 5 minutes. So even if you just get yourself registered, you've accomplished a large task that is not as frightening as it might appear to be. And then as far as the surveys are concerned, in having sat through with many, many people to do them, I think it's important to realize that let's not overthink the questions that are being asked. I think, again, it becomes very overwhelming for people. And so just about giving a clear answer. They're not asking for a novel. It's a lot of like pick and choose for answers, and realize that you don't have to sit and do it all at once. It truly is an activity that you can do when you just have a couple of minutes and you want to answer a few questions. You can always go back to it later, and it's very simply done.
Awesome. Oh, that's so helpful to know. I love the idea of just sign up. It'll take 5 minutes and cross that off your to-do list, and then something you can kind of chip away at when you're ready.
Yes.
That's great advice.
And it's also just so people realize it does open up a lot of conversation for families. So if you have a family member who's assisting you, or in the cases where I've helped people, it really does, it makes people think about what do they think caused their diagnosis. And, I think they find little patterns within the questions, or they just share family information that normally wouldn't have been discussed. So
that's a really good point too. I'm all for the buddy system. So I love that idea. Dr. Mehta, what sorts of projects are currently happening with the biorepository, and are you seeing any barriers for people signing up or choosing not to participate?
So we don't see too many people as in terms of not participating. When they join the registry, they can go ahead and select that information about the biorepository, and we can send them information. There's no obligation to go ahead and give your blood or your saliva at all. It's just information we'll go ahead and send to you. And if patients want to go ahead and do so, they can. The pandemic definitely impacted us because we couldn't go to patients' homes. and that's, the patient safety is paramount. And so we weren't going to be sending in our phlebotomists to the patients' homes to go ahead and do the collections and so forth. And that kind of impacted us. But right now we are, full steam ahead. And so we want to go ahead and kind of make up for those lost years, as I kind of like to call it, because the pandemic impacted everybody's lives, researchers and so forth. And we want to go ahead and kind of, hit the ground running for 2023 and go ahead and get as many collections as possible.
And that's a great segue to our next question. What are the registry's key priorities or initiatives for 2023?
That's a great question. So we currently have a request with the Office of Management and Budget, OMB. And OMB, in case people don't know, they kind of handle all federal data collection activities. And being a federal agency, we have to make sure we adhere to their protocols and their requirements. And this particular request we have in, which we're hoping to get approved probably within the next 30 to 45 days, is going to allow us to release state level data for the first time. And so we could potentially release information, for Illinois, for Indiana, for Wisconsin, and so forth, to look at the number of cases we have in our system. That will kind of give information about, hey, what's happening in your backyard. We're also looking to have new data sources added. So, for example, working with partner organizations such as Les Turner to have those data information added to the registry as well to go ahead and improve our case counts. So we feel that's also very, very important. And we're also revamping our surveys. We currently have 18 surveys, and these surveys will be consolidated down to 5 main categories. And these categories will be listed and named, kind of like demographics and so forth, lifestyle factors and so forth. And this way you can kind of go ahead. The surveys themselves won't change, but they'll be repackaged into a much more user-friendly format for patients to go ahead and take them. So we are very excited about that this year, to kind of go ahead and get those initiatives approved and getting them implemented.
Oh, wow, that's awesome. I can't wait to see what that will look like. And kind of building off of that, but more so a reflection, someone put in our chat a question here of the top 3 scientific lessons learned from the National ALS Registry.
The top 3 scientific lessons learned. Well, I would say certainly, we want to figure out, who gets ALS. That is very, very important. So it's kind of like the who, the what, and the why. And so by figuring out exactly the demographics of ALS, we can kind of figure out, the disease patterns, the actual, what's happening in your backyard, what's happening nationally, and so forth. So that certainly is very important. And the other lessons learned is just to also work with organizations such as Les Turner ALS Foundation and their research partners. ALS is a very small community. Everybody knows everybody. And so it's very important for us to partner and work with these groups, because, like, for example, Les Turner is, we call them boots on the ground. They're the ones working with the patient organizations, so the patients themselves and their caregivers and so forth. So, and you guys know your patients, and you guys know, the caregivers best. And so that's where we want to make sure we support, yourself and other organizations as well. And so, for us, the registry is one of those things I like to say, we're kind of like the United Nations. We want to be everybody's friends, what I'm saying? And we want to make sure, we work with everybody as well. And we want to go ahead and, partner and promote and educate about ALS, because ALS, at the end of the day, it is a rare disease, but it's not a rare disease if you get it. It's a life-changing event. And that's where we want to figure out exactly how we can stop, ALS, reverse ALS, and prevent ALS. All those 3 areas are very, very important. And what the registry does is we work with organizations across the country, and even around the globe, to make that happen.
Mm-hmm. Yeah. Are there any cases that might be missing from the National ALS Registry? So
one of the slides I had, which kind of showed you the number of missing cases we had. Mm-hmm. So because ALS is non-reportable to states and non-notifiable to CDC, it makes it a challenge. So we know we're missing cases, but we're not alone. ALS is not the only disease out there that's missing cases. There's other diseases that are also missing cases too, whether it's Alzheimer's, Parkinson's, or MS. They may get misdiagnosed, or they be missed altogether and so forth, or they're not reported. And so forth. So what ends up happening is, yes, we are missing cases, but what we do is we want to make sure we can count everybody. That's why we encourage patients to come to the registry at cdc.gov/ALS and join and be counted. So you can go ahead and have your information in there as well, securely and safely. Like I mentioned before, your information is never given to anybody. And so, and for us, it is a challenge. We are missing cases, but we are working with the best scientists and the best methods out there to kind of go and figure out exactly, who has ALS and how many what's the number of cases as well.
Yeah, absolutely. And how does, you kind of briefly talked about this, but how does environmental exposure affect ALS risk? And are you funding any specific types of research to look at that further?
So one of the slides I had, so we are actually funding a number of studies. And so one of the studies which comes to mind is University of Pittsburgh, as well as University of Michigan. They're looking at environmental risk factors in their own backyards. They're looking at pollution and so forth, and also looking at various exposures that happen to a particular person with ALS and so forth. And then so from there, so we actually fund a number of studies. That's just two of them right there. We also fund a study through Trinity College, and Trinity College is looking at why do the Hispanic population get ALS at a much lower level than the Caucasian population, non-Hispanic population. And that's done through working with partner organizations or countries in South America. So it's the countries of Chile, Uruguay, and Cuba. Why does that Hispanic population right there get ALS at a much lower rate? So we want to figure out genetically, as well as their exposure risk as well, why that's happening. And that's very, very important to kind of see how come this group is impacted by ALS more so than some other group. And that's what we do here. We want to go ahead and figure that out and go ahead and fund research for those questions.
Yeah, and this may be a little bit more specific, but somebody dropped in our chat, are you investigating geographical clusters?
So the word clusters is a very, very interesting topic, only because right now we're not sure what causes ALS. So if there is a cluster question, for example, let's say there's a elevated number of cases happening in a particular geographic area, we actually would encourage them to go ahead and contact their state health department or their local health department first to kind of go ahead and see what services they could provide and so forth. And then from there, we can kind of reach out as well to see what we can do, because we want to make sure those cases are true ALS cases. Those investigations involve a lot of time and effort, but they're very important because we hear from a lot of people, hey, there's a group of individuals, number of elevated cases in this part of the country or wherever it may be, and it's very intriguing. We're working with a group out of Virginia Commonwealth University, and that particular neurologist has seen that in certain parts of Virginia where they're saying, hey, this particular road down, this particular zip code or street or whatever, this neighbor had ALS, neighbor over here had ALS, and that's very, very intriguing to us. And so, but we also want to figure out actually the etiology, because just because someone's getting ALS, we want to figure out why they're getting ALS. What I'm saying? Were they in the military? Or are they harboring a certain gene that's potentially making them a familial ALS case down the road? And so that's very important. But geographic clusters is something that we do. We get those questions, and our primary response is to make sure that we can kind of go and get as much data as possible from that area into the registry for analyses.
And could this be an area of the survey where you said you have that open text or free text portion of the survey where if somebody maybe suspects something along these lines, that they could free text that and kind of write out why they think maybe what caused their ALS, or being able to put that geographical information into that portion of the survey?
Absolutely, yeah, they can certainly go ahead and put the information in there in that particular survey. Yes.
Great. Is there any information on how existing registrants can or should update their registry?
Okay, absolutely. So if there's information, you can always send us an email, and the email address is als@cdc.gov. So it's a very, very simple email address, als@cdc.gov. You can always give us a call as well, and you can give us a call Monday through Friday, and we have somebody always available and always there to help you out, whether it's a problem logging in or a question you may have and so forth. As well as I would definitely encourage them to go ahead and turn to the resources at the Les Turner ALS Foundation. Kara is a great example. I mean, she knows the registry, very well, and all the capabilities and all the questions, and she certainly, could answer questions that a person may have, or a caregiver may have about the registry too.
And Kara, you've had really good luck with calling the registry, correct?
Yes. If you leave a message, you will usually get a call back within a few minutes. It's beautiful, and they're extremely helpful in terms of resetting people's passwords, and sometimes people aren't sure if they even registered. So they've been very helpful in helping us to find out if somebody is actually registered.
Dr. Mehta, how does the registry know when someone's passed? And is
So
there
we get
anything
data.
specific that loved ones who are already taxed with so much to do, should they be following specific steps after that?
So all our emails that will be coming out soon will have information at the bottom where they can unsubscribe and no longer get emails from us. And that will actually help, not getting these emails coming into their inbox about the registry, and they can go ahead and do that. And so we're implementing that process where there's an unsubscribe option that's going to be implemented in 2023. And it's, some emails already have it, some emails don't have it yet, and they're in the process of getting that particular text. And they simply press the button, they'll go ahead and set up an email back to us simply saying, we want to go ahead and unsubscribe. We also work with the National Death Index, NDI data. And what happens is we get those data on an annual basis. And what ends up happening is we'll go ahead and get that data. And if there's a patient who's passed away, we'll go ahead and remove them from the registry as well, just make them inactive. And so those are the ways we do that, to go ahead and remove those individuals who passed away.
Okay. And you talked about this a little bit, but we know that people get diagnosed at different times and they may sign up for the registry at different times of their diagnosis. Is there any research to better understand the progression of ALS from the time somebody signs up?
So what we do, we also have a risk factor survey, which is very similar to ALS-FRS. And so you take those risk factors, you take that particular survey, which asks you about your disease progression. And that's a really, really important survey because it will kind of help us deduce exactly how, a person with ALS is progressing. If they're a fast progressor or a slow progressor. And that survey is exactly like the ALS-FRS survey that one may take when they're actually at the clinic. And it kind of, helps us to figure out exactly, how they're progressing, like I just mentioned. And it's taken in intervals. So you take it like first when you join, first year you take it 3 times, the second year you take it twice, and so forth. And that kind of helps us, like I said, looking at the actual progression itself and so forth.
Okay. And then if I know I have a specific gene mutation, so maybe C9, or you had mentioned C9 or SOD1, how is that information handled within the registry? Do I need to put that into the registry? Is my information kept private? How would that work?
So that's kind of like a 2-part thing. So when someone's taken the risk factor surveys, there is a question about genetics regarding where you diagnosed and so forth, as in terms of you have a family history of ALS. So there are some certain questions about that. We also do genetic testing as well, and that's done through the NIH. And what we do is with the samples we collect from the biorepository, those samples are all genotyped. And what we do is we'll go ahead and figure out exactly what gene that person has and so forth. And if that gene does relate to the disease itself. So is it C9? Is it SOD1 and so forth? And then from there, we can kind of go ahead and have that data right there. And we're currently analyzing that as well. And we're going to be releasing some information in a publication about those cases we see. But I can tell you what our data show is what everyone's data is also showing as well. In our patient population, we're also seeing roughly 10% of those familial ALS cases. And that's also proportionally what the disease shows as well, about 90% sporadic and 10% familial. But that's really, really important information for us to look at these genetic markers and genetics and the genes themselves and so forth.
And it looks like someone dropped a question in our chat kind of about that. So familial ALS is in our family. Should non-symptomatic family members register?
So you cannot register unless you've been confirmed to be an ALS case. There's a number of questions that one takes when they first join the registry. What was your date of diagnosis? Were you diagnosed by a neurologist and so forth? And so these are validation questions we have that we'll go ahead and have patients answer before they're actually in the registry, just to kind of validate that they are an ALS case.
Great, that's super helpful. And we've had a couple of questions come in either through our registration or in the chat of people that don't live in the United States. Can they join the registry?
So if you are a US resident living overseas, yes, you can join the registry. If you're, let's say from France, and you're a Frenchman or a French woman, you cannot join the registry.
Okay.
But if you live in France, then you certainly can join the registry as an American, yes, or a legal resident, no problem at all.
Okay. And thinking about this globally, how does the National ALS Registry compare to what's being collected globally or some other global databases?
That's a great question. So what we show and what we have found, our data is very similar to the findings that other researchers have also found internationally as well, that ALS primarily affects whites, non-Hispanics, and those between the ages of 50 to 70, and males are more impacted than females. And that's also been shown in the European models as well, and so forth. So I mean, our data lines up very, very well with our international partners. And a lot of those partners have their own registries, or they call them registers, the Irish Motor Neuron Register, and so forth. And so they also do a lot of research as well. But we work with these organizations very closely.
Great. And I'm so glad to hear that we're finally kind of all agreeing on a specific number. But why is the registry only reporting data from 2017? I think that number kind of stood out to me.
That's a great question. We would like to report these numbers much sooner. However, these data do not belong to us. The data which patients report, self-report, those are our data. We can certainly report those much more quickly, but it's incomplete data. And we have to get data from CMS, Centers for Medicare and Medicaid Services, as well as the VA system as well. And those are much larger data sets as well. CMS makes up a large proportion of our data. And those data from CMS are not ready to be sent or not ready to be processed. They're almost like 2 or 3 years behind. And so right now we have the data for 2018. We're working on the data for 2018 right now, and we'll publish 2018 this year. So that's our goal right there. But those data, because they are with other organizations, we have to work with them, and it's not always available in a timely fashion. Believe me, I wish I can get these data more and more quickly, from these organizations, but these organizations are very large. CMS is certainly a very large group, and they get data from a host of other organizations as well. Drug companies, the Part D data. They also get Part A and Part B data as well from hospitals and doctors' offices and so forth. And all that information must be collected, collated, packaged and so forth before it can be sent to us.
Okay, thank you for further explaining that and being so transparent with that. I want to be mindful of your time because I know that you have another appointment that you need to run to. I have dropped some links that had come through into the chat. So the email address again was als@cdc.gov. We have www.cdc.gov/ALS. That'll take you to the landing page. And that's also available in Spanish, correct?
Correct, yeah. So we also have a Spanish landing page, and our surveys are also in Spanish as well. So you can take those risk factor surveys in Spanish, and that is cdc.gov/ELA.
ELA, and that is also in the chat for everybody.
Correct. And then if you go to our main website, at the very top left-hand corner, there's it'll say in Espanol, and you can go to the Spanish page as well.
Fantastic, super helpful. And then I'd be remiss not to plug our website again. So if you're interested in any further resources that we have, my ALS decision tool, our education guides, our a past webinar series, please visit us at lesturnерals.org/resources. All right, Cara and Dr. Mehta, thank you so much for your time today. Everyone on the call, thank you for your time. I want to also plug our next webinar will be February 23rd with Rachel Marsden, a nurse consultant and care coordinator for the Oxford MMD Center for Research and Care. It'll be on ALS and relationships, sex, and intimacy. Thank you again, everyone, for your participation today. If we did not get to your question, I do have copies of that, and Dr. Mehta said he would be happy to answer those for you. So you'll get answers for everyone today. So thank you again. Please take a moment to fill out our webinar survey, which you'll receive immediately after we conclude the webinar. Your feedback is so important to us. It helps us do what we do. So we really take that into consideration. We'd love to connect with you on our social media channels. So you can find us at Les Turner ALS Foundation on Facebook, Twitter, Instagram, LinkedIn, and YouTube. Thank you again for everyone who participated today. Thank you to our panelists. I hope everyone has a safe and healthy rest of the day. See you in February.
Thank you.
Bye.